Good afternoon. My name is Dr. Chris Bird. I'm here on behalf of the Texas Coastal Bend COVID-19 Task Force to give you the weekly pandemic report. We're moving the report from Mondays to Fridays. This is to accommodate my teaching schedule. I apologize for any inconvenience that this causes, but from here forward we will be attempting to do these on Fridays. So, this week's report. We have two objectives on the task force. One is to address your concerns and questions about COVID-19 and the interventions that are being used to combat COVID, as well as enable evidence-based decision-making on behalf of our local leaders. There are presently several interventions in place, and on nuecesnose.com you can see the risk dashboard for COVID, and right now we're at a code red, which is extreme risk for COVID. To try to avoid COVID and slow down its transmission, you're encouraged to stay at home if you can. Face coverings and social distancing are mandated by a governor's order. You're all encouraged to isolate when you're exposed or symptomatic for COVID-19. There's increasingly more remote schooling that's occurring, but also partial schooling that's in place to try to decrease transmission amongst households through children. And then in terms of businesses, we're at 75% of capacity in most businesses. So restaurants and big box stores and places like that. And bars are operating at 50% of capacity. There have been 36,739 total confirmed cases of COVID in the Coastal Bend, with 32,261 recoveries. Now, in terms of the active cases, that's decreased slightly, about 5% over the past few days, and we're down to 3,519 active cases. And you can see the graph here depicting just that slight downwards trend in active cases. Hopefully this is a trend that continues, but at least for right now, I don't expect that this is going to be a long-term downward trend. Looking at our transmission rate estimation, we're at 1.03, which is just above 1. Now, at a transmission rate of 1, that means for every person that gets COVID, they get an additional person sick with COVID on average. Now, at that level, COVID stays at the same level in the community. As this number goes above 1, it means COVID increases, and if it goes below 1, then COVID decreases. So you can see that in the summer, we had a really high transmission rate where almost 3 additional people were getting infected for each original person infected. Until interventions were put into place that decreased the transmission rate down below 1. Now, at Thanksgiving, we had a temporary reprieve where the transmission rate went below 1 and then jumped back up again. And then at Christmas, I've kind of backed off on our projection that there was a big drop in transmission rate. There's maybe only a slight change in transmission rate around Christmas time. And then that transmission rate pretty much remains the same through the future. The reason why this line continually goes down is because as people become infected and recover from COVID, then there's some bit of immunity that's imparted, and that's one less person or that many less people that can contract COVID. So you get a natural decline in the transmission rate. Moving forward to the number of new cases per day across the Coastal Bend, the black points are the observed number of new cases. In the last few days, we've had some low counts compared to last week, where we had some pretty high counts. But overall, the model projection here in orange indicates that we're going to continue to rise for at least another week or two in terms of number of new cases per day, and that's across the whole Coastal Bend. I want to point out that I'm no longer going to try to predict the day at which we might transition from 75% business capacity to 50% business capacity, and rather What this model projection shows is what happens, or what's projected to happen if the business capacity doesn't change, but all of our interventions that are taking place right now, like wearing masks and social distancing, they also don't change. And so when we cross that threshold from above 1 to below 1, that results in change from increasing new cases per day to decreasing new cases per day in the future. Now we'll see, do we follow this trend, or do we actually trip the threshold of businesses being rolled back to 50%, in which case we might expect a stronger drop or maybe an earlier drop, or do we see something where the cases go higher than the model predicts, which would indicate that something's changed to allow the transmission rate of COVID to increase. So we'll follow that moving forward, with this new projection being the one that we follow. Now, breaking down the new cases per day across the coastal bend into the different counties, you can see over the past week that Nueces has had a downward trend overall. And this is being precipitated in one respect because last week there were a number of high case days, but also this week there's some pretty low case days. Now this is a good trend. We hope that this trend continues downwards, but as you saw from the previous slide, we don't expect that it will continue going down. For San Patricio, they only report their cases once a week. They do report it on Fridays, but they haven't reported it today yet, at least not in a form that I have access to. So that's why you see this rise and then fall, but expect that there will be a new report today, and that will increase again. I'm going to move forward to our next slide. It's the same as this last slide, except you can see all the other counties in the coastal bend. Here's the ones that are increasing: Clayburgh, Aransas, and Refugio. Over the last month, they exhibit a general increasing trend, even if over the last week they've decreased. Then the next section are the 7 counties: San Patricio, Jim Wells, Bee, Duval, Live Oak, Brooks, and Kennedy, that show no trend over the past 28 days. And then lastly, the one county, McMullen, which has had a net downwards trend over the last 28 days. Zooming out and looking at South Texas, these are metro areas in South Texas. You can see that Laredo continues on this pretty large spike. And this gives me some bit of concern because this spike occurred after there was already a fair amount of COVID. They had already triggered their business capacity rolling back to 50% and bars closing. And then this spike happened after all that. So I'm hoping that something like this doesn't happen locally. I'm not sure why this happened. I've been reading all the news articles about Laredo and what's happening there, and I don't really see any explanation for why this happened. But one of the explanations that's on the board is maybe pandemic fatigue could have led to people letting down their guard. So we definitely don't want to let down our guards here. If you look across the rest of these metro areas, you can see increasing patterns. With Nueces, it's very difficult to see there, but just curving slightly downwards. The only county that's included here that is curving downwards on a long-term trend. Zooming out to the whole state of Texas, these are the public health regions across Texas that affect the management of hospitals and things like that. And what you can see is that across all the public health regions, there's only one, the one where Amarillo is, that is decreasing. And in all the other public health regions, the per capita number of new cases per day is increasing. It's increasing the quickest in South Texas, and that again is being driven by Laredo and the big spike in cases that have been occurring there over the past 2 weeks at this point. But even here in the coastal bend, overall cases are increasing. So it's not just Laredo, but there's other parts of South Texas that are contributing to that trend also. Moving on to hospitalizations, we're seeing a continued increase in the number of hospitalizations in the coastal bend. And what I've done here with the model, so the model is in orange, and the observed number of people in the hospital with COVID on any given day are the black data points. I've had to adjust the calibration of the model such that it doesn't fit the data right before Thanksgiving versus after Thanksgiving. So this is an after Thanksgiving calibration, and really the way the model fits in the past is no longer important to us. What's important is accurately projecting the future. So given the current recalibrated model, it looks like we expect the number of COVID patients to continue to increase for at least the next 2 weeks. Looking at the percent positivity rates, and what this refers to is of all the staffed beds in the hospital, how many of them or what proportion of them are occupied by COVID patients. And right now, the last data point that I have is 14.3% of all the staffed beds have COVID patients. The reason why this is important is because if we go above 15% for 7 days, that triggers that business occupancy rollback to 50%, and it triggers the closing of bars. Now, this rollback has happened in Jim Wells County in January, but it hasn't happened in any of the other counties in the coastal bend, at least not yet. And we're right there at the threshold, so we're gonna see what happens here. Turning our focus to the ICU, and these are the numbers from January 20th. That's the latest data that's been released by the state. There are 53 patients, COVID patients in the ICU, with 132 non-COVID patients, for 185 total patients in the ICU. This blue line represents the average number of patients in the ICU prior to the summer outbreak here in the coastal bend. And you can see right now we have more patients than normal in the ICU, and a lot of that's being driven by having a lot of these COVID patients in the ICU. There is an increasing trend here, and we do expect that trend to continue for at least the next couple weeks. Now, zooming out to the whole state, this is just January 20th. It's the same figure as you saw previously, but for every trauma service area across Texas for just 1 day. And I think that this is a good measure of the amount of stress or strain that's being applied to the ICUs by COVID. So here we have about 1/3, or right now slightly less than 1/3 of all the patients in the coastal bend are COVID positive. Whereas in Laredo, you're looking at maybe 75% of all the patients in the ICU are COVID positive, versus the blue representing non-COVID positive patients. And so when you see this high amount of red relative to blue, that's indicating a high level of strain on the normal resources that are dedicated to intensive care units in the different trauma service areas. If you look at the numbers on the axis, obviously there's more people in Houston than there are in Victoria. Different trauma service areas have different numbers of people. The purpose of this figure is to show you the level of strain on the ICUs in different sections of Texas, in case you're planning to travel there, or maybe you have loved ones that are there and you're interested in what that looks like. And right now, if you look, the coastal bend, Lubbock, and Galveston are the places with the lowest metrics here. And here's one more graph. You can pause this video to inspect it if you're interested, but this is the same sort of graph, but instead of having just 1 day, this is all the days since June or even May for the number of patients with COVID in the ICU versus non-COVID in the ICU. Moving forward to fatalities, we've had an increasing trend in fatalities since October, about mid-October, and that's continuing through now in mid-January. And we expect that to continue into late February, at least right now, with the model projections the way that they are. And if you look on a per county basis, you can see that new fatalities per day are increasing in several of the different counties around the coastal bend, not just in Nueces. And that brings us to our total count. Right now we're at 959 citizens of the Coastal Bend that have succumbed to the effects of COVID and have died, with 611 of those people being in Nueces. Now again, this data is a day old. So there's a newer report for Nueces County, which would result in a slightly higher number. And then today there will be, even another report. I think it's important to understand that this bright red line with the 959 people for the Coastal Bend, this data comes directly from the state where they count death certificates. It takes a while for those death certificates to get processed, usually about 14 days. And that's why you see this leveling off here. Those are days where death certificates have yet to be processed for the Coastal Bend. So we do expect these numbers, unfortunately, to continue to climb. All right, in summary, the transmission rate is still above 1, and the fall and now winter outbreak is continuing in the Coastal Bend. New cases, hospitalizations, and fatalities are increasing across the whole Coastal Bend, while in the last week, in some counties, there has been a noticeable decrease of new cases. The important thing here is that our model predictions indicate that we will transition to an increase in new cases again, and it's important to stay vigilant. We discourage multi-household celebrations. You're encouraged to do all the things that you're doing already to stop the transmission of COVID. Wear your face coverings and social distance. Get vaccinated if you're eligible. And these measures and more, you can go to nuecesknows.com and see a list and a bevy of other things that you can do to help to combat the transmission of COVID-19. And you can get a lot of information there about getting vaccinated. In doing these things, we can help to keep the transmission rate low and try to prevent a spiking outbreak like Laredo is experiencing, or we saw earlier in El Paso and Lubbock in the fall. So stay safe, everybody. I hope you have a good rest of your Friday, and we will return next Friday with our weekly Q&A. So please direct your questions to our social media accounts at CBCovid, Facebook, Twitter, and Instagram. And we'll address those questions on Friday at noon. We also try to address questions on the fly during the week, replying to them on the social media accounts. And we will give the next pandemic report next Friday at approximately 2 o'clock. All right, thank you very much.